And welcome to another episode of Health Digest, a program where we bring to you news, analysis, and developments on the realm of well-being. I'm Ogom Ezedimbu.
Here is a new and refreshing offer for our esteemed audience across the globe. The new AIT Cloud TV is an online streaming service that offers you attractive opportunities to view our rich, exciting, and entertaining programs anytime, anywhere. AIT Cloud TV is available on the web on www.ait.app, Apple TV, Amazon Fire TV, Roku, and Android TV. You can also download the mobile app from the Google Play Store or the Apple App Store. Simply connect to the internet, download the app, register, and watch live or catch up on unlimited hours of exciting shows. AIT Cloud TV. TV on the go.
April 25 is World Malaria Day. We're diving into the theme of accelerating the fight against malaria with a particular focus on malaria resistance. My guest is Dr. Ekpo Edet, Program Officer, Breakthrough Action, Nigeria. He will be shedding light on this topic. Welcome to the program.
Thank you so much.
Now let's begin this way. There's a staggering statistics provided by the World Health Organization where malaria accounts for nearly 27% of the global malaria burden and 31% of malaria-related death. Isn't this too much?
Yeah, that's too much, especially if you think of it not only as a number, but as lives affected. Maybe to start by saying that malaria affects actually 68 million people. We've had estimated 68 million cases and 194,000 deaths. So this is really significant, and we really have to do something about it. You've just mentioned that we contribute 27% of the global malaria burden, and that's really huge. One country carrying that burden, that large percentage, so it calls for, concerted action to end this public health disease.
So what are the likely contributing factors, reason we are resorting to this number?
Okay, I think first of it would be that a lot of people are still not educated very well about malaria. Lack of awareness is a big problem. I should say that sociocultural norms, beliefs, myths, and misconception also add to it. We can't rule out the issues around the health system, access to services, and all of that. So those are real issues. But thankfully, the health system issue is not really a problem now because we have primary healthcare centers providing malaria services. So I think the issues I've mentioned before now are the real issues around malaria control. So we have people, I talked about sociocultural norms, beliefs, myths, and misconception. There are people that don't really believe that malaria can cause serious problems. They think it's just one disease, they can play with. Some people say you could take herbal medications and it solves it. Some say you could drink the local herbs, agbo, lemongrass, and all of that. So all of those myths, misconceptions are really affecting how people take up the desired malaria behaviors, like seeking prompt care for fever, testing before treating for malaria, sleeping inside insecticide-treated nets, and what have you.
So are these the reasons we're having malaria resistance these days?
So I think the issue of malaria resistance should be discussed with care. So are we talking about resistance to the drugs now, or resistance to insecticide-treated nets? But first of all, I think I'd like to address the issue of resistance by saying that nationally, there is no documented evidence of significant, resistance to the artemisinin-based combination therapy. None of that, so it's not an issue. What we had earlier was issue of chloroquine resistance, after which they had to recommend the artemisinin-based combination therapy. So if people are taking up the right medication, I don't think the issue of resistance should be mentioned at all. Another thing is poor health-seeking behavior. So you have people who have fever and they decide to treat at home for malaria, assuming it's malaria. But they don't realize that fever can be a symptom of many other conditions. And so they treat and say it's malaria, and they treat and it's not working. So they say it's the medication, not knowing they were actually treating for the wrong condition. And of course, we cannot rule out the issue of fake drugs out there, which is why it's important that when you buy a malaria medication, you scratch that pin. There's a scratch pin there. You need to scratch that and, send whatever the instruction they give to you to that NAFDAC line. That tells you whether the medication you're taking is adequate or not. With regard to insecticide-treated nets, yes, in some parts of the country, there have been tests that, studies that have been done, and it shows that there's resistance to the single type of insecticide that has been used, and that is why insecticide-treated net campaigns now are using, not just one insecticide, but a combination to ensure that that issue of insecticide-treated net resistance is addressed.
Now, I'm going to go back to where you talked about poor seeking behavior. Now, someone who doesn't test before treating malaria and goes ahead to buy malaria medication, and maybe the person doesn't even have malaria, isn't that a breeding ground for malaria resistance?
Yeah, that's a very important question. Of course, generally with medications, you would expect that if you keep taking the medication for the wrong thing, over time, maybe the organism in the system builds up a resistance against that particular drug. But with malaria, I don't think that's the documented issue. But just to say that people should really not take malaria medications. If you take medications for the wrong thing, you're causing a whole lot of problems for yourself. One of them could be resistance. But like I said, until we are able to demonstrate by evidence that there is significant resistance to the current medications that we have, then
But don't you think we are going to have that problem, looking at what happened to chloroquine?
To chloroquine. Yes, we absolutely may have that problem, and that is why you're doing what you're doing, and I'm doing what I'm doing, trying to reach out to the general public and give them the right information about malaria.
But you had talked about PIN. You say if you scratch the medication, you find some. Is that working in Nigeria?
Yes, it's working. I do that personally.
Well, how quick do you get response?
Yeah, a quick response. I've
done that before. That's what I'm asking you.
Okay, you've not had that
I've done
quick
that.
response.
No, I didn't get response like after 5 days, and I've taken my medication well. So if I was going to die, maybe I would have been dead by now.
Oh, so I'm sure the appropriate agency is watching us right now, and particularly NAFDAC. We should be aware of this so that they, sort out whatever problem they have at their end. But I know that I've had to use medication, and I scratched the pin, sent to the short code, and I got the response saying genuine, okay, so I had to take it.
Now, looking at the team, accelerating the fight against malaria, are we on the right track as a country?
Accelerating the fight, yes. I would say that we're on the right track. I see a strong political commitment so far. I see an agency, the National Malaria Elimination Program, committed to this. I've worked closely with them in the course of my work, and I know that they are in the right direction. So I think we're doing well. There are several interventions so far by the National Malaria Elimination Program, and those interventions include integrated vector management, like trying to deal with the mosquitoes that convey the disease we're talking about, the malaria. And now they do that through insecticide-treated net campaigns where they distribute nets to people, tell them about the benefits, how to use, how to care for them.
Who are they distributing it to?
Yeah, to the general public. So we've had that
communities
in different
or urban areas?
In different states,
Okay.
So they deliver to community members, So everyone has access to it, regardless of your social class, especially those at the grassroots, they benefit more from it. So we've had series of campaigns. We've had in Ebonyi, you had in Akwa Ibom, we've had in Benue, Zamfara, Plateau. I think Plateau is going on, if not wrapping up right now as we speak, and in many other northern states of the country. So that's one intervention that the National Malaria Elimination Program with implementing partners are doing to help the public. We also have seasonal malaria chemo prevention, campaigns where they give drugs to children, so that also is another intervention. Now we also have case management where you walk to a health center, no matter how basic that health center is, if it's a primary health center, where you can have the basic test, rapid diagnostic test for malaria, and you can get the treatment at a very affordable cost. So those are the things that government is doing. And then we have what is called advocacy, communication, and social mobilization, where we're going out, government and implementing partners are going to the people right at the communities where they come from, giving them the right information about malaria, the transmission, the dangers of malaria, and what to do. And even in our organization, we go beyond that to engage healthcare workers, because we've discovered the issue of poor attitude, of healthcare workers is really deterring people from, coming to the health facility. So we work with them, help to change their behavior, help to make them adhere to the national guidelines, on diagnosis and treatment of malaria. So the country is doing a lot. And you talked about the World Malaria Day in your introduction, and I can tell you that I'm just leaving the venue where we had the press briefing. We had a road walk and we just had the press briefing. But before now, we've had church sensitization, mosque sensitization. We've even had a community outreach in Impape area in Abuja here, where we reached out to that community that seems to have a high burden of malaria, telling people about malaria and then giving insecticide-treated nets to them, telling them demonstrating how to use it and how to care for it. So I think the government is doing a lot. And at this point, we're talking about accelerating the fight against malaria, because yes, we've made progress. There've been a lot of cases have been averted, a lot of millions actually of deaths have been averted, but we are not where we are supposed to be. We're not supposed to be talking about malaria control right now. We're supposed to be talking about malaria elimination. And we have countries that have achieved that, but Nigeria is yet to achieve that. And that's why the theme for this year is accelerating the fight against malaria for a more equitable world. Thank you.
Yeah, you talked about your programs you had for the World Malaria Day, and people who were not able to participate in all of your programs you mentioned. In what way can they actively participate in all of this? Okay,
maybe just to say that this program was not only done nationally, in all the states of the Federation. Yeah, similar activities have been going on, the sensitization, the outreach, the road walk, the press briefing, distribution of things, so that's what has been happening there. But I was asked a question just recently in another interview, should we actually be focusing on World Malaria Day? Shouldn't this be a daily lifestyle? And I agreed absolutely with them. We're not supposed to be talking about malaria, doing all of what we're doing just to commemorate the day. We're supposed to do that, consistently. And that's why we need to, it's not just the National Malaria Elimination Program that should do this. Maybe we have to engage more implementing partners and civil society organizations and even well-meaning individuals to look at some of these programs and see how they can be conducting them on a sustained basis so that we can have the necessary traction that we need.
You also talked about insecticide nets, giving it out. Let's look at it beyond just giving out these nets. I know you said you've taught them how to use it. Any sort of monitoring to ensure that these people, because sometimes when you give them this net, they'll go back and then sell it because they have to think of their stomach first. So any sort of monitoring?
Yeah, that's a very brilliant question. After every insecticide-treated net mass campaign, we carry out a survey. People actually go to the household randomly, to check if they've actually received, if they heard about, if they've received the nets, if they are using it. And what happens is when you give out the nets and do that survey and find out the areas that are low performing in terms of using it, because it's not just to take up a commodity, it's how you use it that makes the impact. So we check those who are not using it. our organization, for instance, help those community members. Some of them say, oh, I didn't hang it because I don't know how to do that. So we had to help them, you know, put it up, you know, and all of that. So we work to address all of those issues, yeah.
So what role do partnership play in all of this, from the pharmaceutical companies, from the research institution, public health experts? What role do they play in combating malaria?
I should say that they are already doing their best, but of course we could do better. Yes, so the National Malaria Elimination Program, for instance, doesn't just work alone. Okay. It works with World Health Organization, United States Agency for International Development, Global Fund, and many other implementing partners, you know, and these partners work virtually in all states of the Federation. So they are actively partnering to, you know, combat malaria. So that partnership is ongoing. But maybe just to say that we may need to do more research in malaria. We're doing, I know there are therapeutic efficacy studies, insecticide resistance monitoring and all of that, but we can do more. We can test even newer interventions, you know, and interventions that are not strong in terms of research, things like social and behavior change interventions. Maybe we should have organization, you know, engaging in more research, testing the effectiveness of such interventions. And at Breakthrough Action Nigeria, we've actually carried out a survey, you know, to test media interventions, you know, and to see the effectiveness. And we found that radio spots, a particular radio spot we actually put out there were effective in making people, you know, to test for malaria, especially for their under 5 children, and also to use the artemisinin-based combination therapy. But that's just a small research, and we need to do more of that large-scale research, you know, research on interventions, research on the medications, more research on the insecticide-treated net resistance and all of that. And I believe if we do that, it will, you know, inform how we tailor our interventions. Now, the research that the government has done working with implementing partners has helped us to now begin to look at subnational tailoring, where you are not just bringing out intervention for the whole country as a whole, but you are looking at the peculiarities at the states. Which states have this problem? Which states have that problem? What kind of interventions will address this problem in this state and all of that? And we're already at that stage, and I believe if we continue in this direction, then the issue of malaria will be nipped in the bud.
What can we do or say regarding this? Will I call them mobile pharmacists or mobile pharmacy? Which of them will I give to?
Community pharmacy?
No, not even community pharmacists. The mobile ones, the ones that carry their drugs and they go for. You've not seen them? They go to markets, they go on the streets, and they sell malaria drugs. What can we say about them? What should be done?
Okay, so maybe we have to be sure they are selling malaria drugs, because most of those people will tell you that this drug can treat malaria, it can treat typhoid, it can treat urinary tract infections in the park. That, you know, so I think our regulatory function will have to increase, and the agency responsible for that is actually NAFDAC. You know, so we really need to
because
do more.
If you're preaching tests and treats, and these people, even the community pharmacists, some of them, you just walk up to them and say, please, I feel pain, my joints are paining me, I feel tired. And they tell you, I need malaria. And some of them don't even tell you, okay, go and do a test or anything. They just sell their drugs, maybe because they want to make profit. So such persons, they are contributing to it. So what do we do? What can be done about it?
So it is true that some of these people are, or if not many of them,
even doctors are guilty as well.
Yeah, are profit driven, and I wouldn't excuse it. I'm a medical doctor. I wouldn't excuse some doctors. You know, maybe because of the overwhelming workload, sometimes they just get your symptoms and say you have malaria and give you the medications, and that's why we're preaching to everyone. And that's why government and partners should engage community pharmacies, patent, you know, proprietary medicine vendors, you know, engage them with them, pass on the right information to them, tell them what they need to do before. I think TB is also doing that, and malaria should, engage with them, so that when people come with these symptoms, it makes them trust them more if they can tell them, oh, for you to have the best treatment, we need to do this rapid diagnostic test for you. If it's positive, we'll treat you for malaria. If it's not, then we'll assess you for something else. That adds credibility to what they are doing. So I think rather than perhaps condemning them, rather than putting a blame on the regulatory functions of our system, then perhaps we need to draw these people closer, give them the right information, change their perceptions, their behaviors, and make them begin to do what is institutional, what is documented, what is evidence-based. I'm sure if we do that, we'll have a better Nigeria free of malaria.
Before I let you go, I just want you to say a last word to people watching and how we can find a way out of malaria.
Okay, I think just to the general public out there, my first call to you is that malaria kills. You should act now, accelerate the fight against malaria. Ensure you test all fevers before treating, because not all fever is due to malaria. I'd also encourage you to keep your environment clean. Of course, that's basic, that's a given. Keep your environment clean. Any drainages and all that should be kept. You don't allow waterlogged areas, because those are breeding sites for mosquitoes. It is that time when we need to procure insecticide-treated nets and use them, because I've actually had encounters with people who have said they've not had malaria for about 3 years, 5 years, because they and their families have been sleeping inside insecticide-treated net, I beg your pardon. For pregnant women, I must encourage you to please register early for antenatal services, and also ensure you attend all the classes, all the antenatal visits. And during this time, your health providers are going to give you, from 13 weeks of pregnancy, they're going to give you a medication that is called intermittent preventive treatment, for malaria during pregnancy. It's a drug, it has a long name, but your health providers know what to give to you, and they'll be giving this to you every month, until you deliver. These drugs, they are safe, they are effective, and they prevent malaria. It is important to do so, because malaria can not only affect you, but your unborn baby, and can lead to miscarriages, it can lead to low birth weight babies, it can lead to stillbirth. So take action now, act now, and accelerate the fight against malaria. Thank you.
Thank you so much. And we have been speaking with Dr. Ekpo Edeth, a Program Officer, Breakthrough Action Nigeria. Thank you for your contribution on Health Digest today.
Yeah, you're welcome.
And that's our package for today. Thank you for being a part. I'm Ogom Ezedimbo. To stay safe.